Imagine walking through a place you know. You recognize where you are, nothing around you has actually changed, but something feels wrong. You look at your hand, you know it is your hand. You can move your fingers, you can feel them, but for some reason, it doesn't completely feel like they belong to you. You look into a mirror, that's your face. You know that's your face, but looking at your reflection feels strangely similar to looking at somebody else. Maybe your emotions seem distant, your thoughts feel detached from you. You feel as though you're watching yourself live rather than actually participating in your own life. Or maybe you feel normal, but everything around you seems strange. People, buildings, sounds. The world can feel dreamlike, foggy, artificial, or strangely distant. And one thought keeps running through your mind. What I've just described are two forms of dissociation called depersonalization and derealization. Depersonalization involves feeling detached from your body, thoughts, emotions, sensations, or actions. Some people describe feeling robotic, emotionally numb, or like an outsider observing their own life. Derealization involves feeling detached from the world around you. People or objects can feel unreal, dreamlike, lifeless, foggy, or visually strange. When these experiences become persistent or repeatedly return and cause significant distress or interfere with someone's life, they can be part of depersonalization derealization disorder, classified in the DSM-5-TR as 300.6 or F48.1. But here's something extremely important. If you were the person in our example, you might be terrified that you're developing psychosis or completely losing touch with reality. But DPDR has an important distinction. You know your hands actually belong to you. You know the people around you are real. You know the world has not literally transformed. It just doesn't feel real. That insight is part of DSM-5-TR diagnostic criteria. For a diagnosis, a person must experience persistent or reoccurring depersonalization, derealization, or both. They retain awareness that these experiences are subjective rather than actual changes in reality. The symptoms must cause significant distress or interfere with important areas of life, and a clinician has to determine that these symptoms are not better explained by a substance, medical condition, or another mental disorder. So how many people actually experience this disorder? Temporary experiences of depersonalization or derealization are much more common than the disorder itself. However, a recent systematic review found estimates between 0 and 1.9% of the general population, with an overall prevalence of approximately 1%. Rates are considerably higher with psychiatric populations. So if you've experienced a brief moment of feeling disconnected, that itself does not mean you have DPDR. Now, you might ask, why is this happening to me? The answer is complicated. Researchers have not found one single biological cause to DPDR. Studies have identified differences in brain systems involved in emotional processing, sensory integration, perception of the body, and our senses of self. One model suggests that the prefrontal brain activity may suppress some of the emotional responses that would normally make an experience feel personally real or emotionally significant. Genetics may contribute to a person's vulnerability to dissociation, but there is not a well-established heritability percentage significant for DPDR. One twin study found that genetic influences accounted for about 48% of the variation of pathological dissociative experiences. That's useful evidence for genetic contribution, but it studied dissociation broadly, so we could not claim that DPDR itself is 48% genetic. Biology isn't the entire story. DPDR is also strongly associated with stress and environmental experiences. Severe emotional stress can trigger symptoms. Reported risk factors and triggers include childhood emotional abuse or neglect, physical abuse, witnessing violence, unexpected loss, interpersonal or occupational stress, depression, anxiety, and certain drugs. That doesn't mean everyone with DPDR has experienced trauma, and it doesn't mean everyone who experienced trauma will develop DPDR. Instead, researchers generally view the disorder as involving an interaction between psychological experiences, environmental stress, and biological vulnerability. Research on dissociation also supports connections among traumatic experiences, genetic vulnerability, and biological stress response systems. Eventually, you decide you want help. So can DPDR be treated? Yes, but there is one important limitation in the research. Psychotherapy is the primary treatment approach, and techniques may include cognitive and behavioral strategies that reduce obsessive attention to symptoms, address stress, and help the person reconnect with everyday activities. Grounding techniques can also use physical sensations, sight, sounds, or other senses to redirect attention toward the present environment. Medications may be used when someone also has depression or anxiety, but no medication has consistently demonstrated effectiveness, especially for DPDR. And while treatments include psychotherapy, medications, and brain stimulation techniques have all been studied, a 2024 systematic review concluded that the overall quantity and quality of treatment research remained limited. So there currently isn't one treatment that can honestly be considered a guaranteed or universally successful method. Now return to the person we met at the beginning. You still have to go to work. You still have classes. Bills still need to be paid. People still expect you to answer when they speak to you. But imagine trying to concentrate on your job while the room around you feels like a dream. Imagine trying to enjoy something you normally love while your emotions feel muted. Now imagine looking at someone you love, knowing exactly where they are and knowing exactly how much they mean to you, but struggling to feel the emotional connection. DPDR symptoms can be chronic, and for some people, the ongoing sense of estrangement, anxiety, or depression can become seriously disabling. And that is part of what makes the disorder so important. A person with DPDR may look completely normal from the outside. They may speak to you normally. They may understand exactly where they are. They may know that nothing supernatural or impossible is happening, and they can still be suffering tremendously. And that makes awareness important. Someone saying that they feel unreal, disconnected from their body, or separated from the world around them shouldn't automatically be dismissed as a dramatic attention-seeking or crazy. These experiences are recognized symptoms of a real dissociative disorder, and treatment and recovery are possible. For the past few minutes, I've asked you to imagine what it would be like to live while feeling disconnected from yourself or the world around you. For you, that experience ends when the video does. For someone living with depersonalization, derealization disorder, it may not. Feeling that reality is unreal does not necessarily mean someone has lost touch with reality. Sometimes the frightening part is knowing that they know perfectly well what's real. Still can't make it feel real. That's why depersonalization, derealization disorder deserves understanding, attention, and treatment.